Hi, I'm Dr. Ed Kenshock, and I've been practicing here at Cape Fear Eye Associates since 2002. One of the changes that I've seen take place here at Cape Fear Eye Associates since I first started has been the advancement with technology. And some of that technology you can experience during your regular eye exam. And I thought I'd take the opportunity to describe some of those advancements here today. The first thing that we offer here at Cape Fear Eye Associates is what's known as fundus photography. This is a test which is completed which allows us to evaluate the posterior aspect of the eye, namely the retina, optic nerve, blood vessels, and macula. This test is particularly useful in patients with diabetes, macular degeneration, glaucoma, and also with a choroidal nevus. So for diabetic patients, the test allows us to evaluate the blood vessels and look for diabetic retinopathy. In glaucoma, it allows us to evaluate the health of the optic nerve and to make future comparisons. In macular degeneration, it allows us to evaluate the part of the retina known as the macula. For a choroidal nevus, which is a freckle of the retina, it allows us to document the size and appearance so that we can monitor for changes over time. With this, we are able to obtain a digital image that goes in your record for future comparisons. It helps us with the initial diagnosis, but the true benefit is to monitor for any changes over time. The second test, which you may experience at Cape Fear Eye Associates, is what is known as an OCT, which stands for Optical Coherence Tomography. This test allows us to evaluate the retina of the eye and is particularly useful in diabetic patients, where we look for macular edema, and in patients with macular degeneration, it allows us to evaluate the different layers of the retina. It is a very valuable test that allows us to detect change prior to vision loss occurring. It also helps us with treatment and monitoring for improvement in vision. The same machine also conducts what's known as a nerve fiber analyzer. This test allows us to evaluate the health of the optic nerve, and this is particularly useful for glaucoma, both in the diagnosis, treatment, and monitoring. Another test which is also conducted here at Cape Fear Eye Associates is what is known as a specular microscopy. This test allows us to evaluate the front surface of the eye, particularly the cornea, whereas the previous tests I mentioned allowed us to evaluate the retina and the posterior aspect of the eye. The benefit of this test is it allows us to evaluate the health of the cornea, which becomes very important for patients who have Fuchs dystrophy, which is a condition where corneal edema may occur, and also for those patients who are undergoing cataract surgery. It allows us to make sure that the cornea is healthy enough to undergo the surgery. One additional advancement in technology is with an auto-refraction. An auto-refraction is a test which enables us to obtain one's eyeglass prescription objectively. It is a very useful test for patients who are too young to respond or communicate, or for those patients who may be unable to communicate the results. When I first started in 2000, LASIK eye surgery was becoming more the mainstream. Today's LASIK eye surgery is more advanced. We often had patients who obtained good visual acuity, but yet were not real satisfied with the results, and it was difficult to understand why. Today's LASIK eye surgery addresses the entire visual system. It provides a totally customized treatment approach, and we are better able to provide not only good visual acuity, but an overall good visual outcome that's more satisfactory. One additional advancement in technology here at Cape Fear Eye Associates is electronic medical records. Initially, a paper chart was used. However, today's electronic medical records allows us to keep one's data more secure, comprehensive, and complete. We're able to incorporate all the testing that we do in the office into an electronic file. This enables us to communicate better with other eye care providers, and including your primary care physician. This is particularly useful in communicating with the primary care physician for diabetic patients. It enables us to communicate the eye exam results and whether or not any diabetic retinopathy is present. I hope this gives you an overview of some of the testing that you may experience at Cape Fear Eye Associates and why it is being done. I would encourage you to ask your eye care provider to show you the test results and give you a brief explanation of why things were done. This will better enable you to understand your overall eye health.